Novel coronavirus, the agent responsible for coronavirus disease 2019, or COVID-19, is producing a growing public health emergency in not only China, but across the entire world. As the number of confirmed cases and deaths continues to rise, clinical details of COVID-19 have become available through case reports and public health partners. However, the complete clinical spectrum is not fully understood, and healthcare providers might not be familiar with the most recent information regarding the spectrum of details and the state of treatment strategies for this infection. There is a need to educate healthcare providers and the public on the key measures that we can collectively utilize to prepare for handling persons under investigation, also known as PUI, and reduce exposure to help prevent infection. This video aims to be a source of information and an update regarding the state of the epidemiology, diagnosis, clinical course, and state of treatment strategies for COVID-19 disease caused by the SARS-CoV-2 virus. In addition to this, it also aims to provide healthcare providers with guidance on handling PUI and to reduce the risk of transmission.
In terms of reducing exposure, facilities should have policies in place to limit exposure to COVID-19. Signs and posters regarding respiratory hygiene and cough etiquette should be posted in healthcare facilities. Travel to high-risk areas should be avoided, and persons returning from high-risk places, as well as people who have come into contact with these individuals, should be assessed by a licensed healthcare provider. If you or a patient meet any of these criteria and are symptomatic, meaning you have any one of the following: fever, cough, shortness of breath, you need to see a healthcare provider for evaluation of your condition and to determine whether you have the coronavirus infection.
For a previously identified PUI who is making an appointment before arrival, first, the PUI should be instructed to call ahead and wear a face mask upon entry to the hospital. Face masks prevent transmission of the disease from an infected individual and is important for protecting other patients as well as healthcare workers. Secondly, before arrival, PUIs should go into voluntary isolation in order to prevent the spread of COVID-19 before symptoms present. Previous studies have indicated that COVID-19 can be asymptomatic for a period of 2 to 14 days, so a healthy level of caution is advised. Healthcare providers should isolate PUIs upon arrival in a negative pressure room if available, and in addition, designated or disposable equipment should be used when taking care of a PUI.
In general, people should be cleaning their hands often, including immediately after removing gloves and after contact with an ill person, by washing hands with soap and water for 20 seconds. If soap and water are not available and hands are not visibly dirty, an alcohol-based hand sanitizer that contains at least 60% alcohol may be used. However, if hands are visibly dirty, always wash hands with soap and water. Household members should follow normal preventative actions while at work and at home, including avoiding touching your eyes, nose, or mouth with unwashed hands. Hands should be especially washed after blowing one's nose, coughing, or sneezing, after using the restroom, before eating or preparing food, after contact with animals or pets, before and after providing routine care for another person who needs assistance, for example, a child.
As a population, in order to keep ourselves and our family, friends, and neighbors safe, caution should be practiced without panic. Avoid gatherings of more than 25 people. Practice social distancing. Wash hands frequently. Avoid touching your face, and above all else, if you feel at all sick, contact a healthcare provider and practice voluntary quarantine.